Thank you. Good morning. Thank you for coming here today. I'm New York State Attorney General Eric Schneiderman, and I'm very pleased to be here in Guilderland to talk about a life-saving public health initiative that begins right here. Joining me today are our host, Police Chief Carol Lawler, Albany County Executive Dan McCoy, Senator C.C. Hatchick, Assemblymember Pat Fahey, Guilderland Town Supervisor Ken Runyon, and Dr. Donald Doynow, who is the Medical Director for Guilderland Emergency Services, and some other members of the Town Board. I thank you all for being here, and I commend Guilderland for being the first community in the state of New York to take advantage of our new Community Overdose Prevention Program, or COP program, through which my office is funding any police department or law enforcement agency that wants it. We are reimbursing them for naloxone kits. Naloxone is an amazing drug that saves lives. And we today have provided the police department here with $2,100, which will pay for 35 kits containing naloxone. Every police officer in Guilderland will now be able to carry a naloxone kit, putting the power to save lives in their hands. This is the beginning of the first round of awards that my office is committed to pay for more than 1,000 naloxone kits for 39 police departments in 30 counties across the state. The demand has been extraordinary since we announced the COP program a very short time ago. We committed a total of $5 million, which we think will cover naloxone kits for pretty much any police department that wants them. And if we have to generate more funds, we're prepared to do that. We're taking the money from forfeiture money. In cases where we work with the federal government and get money, much of it from, in fact, from drug gangs, we are able to use it for law enforcement purposes, including funding police departments, as we are doing here. We have already gotten more than 100 requests for nearly 3,300 naloxone kits statewide. This is a very, very important tool for law enforcement, and Guilderland's Police Department is the first to receive these funds. I thank Chief Lawler for stepping up and being ready to go with this program. And I want to say that in the Hudson River Valley, there has been the highest per capita hospital admission rate for heroin overdoses in the state of New York. So it's very appropriate that we are starting the COP program here. Albany County ranks 6th out of all of New York's 62 counties for the number of opioid-related hospitalizations per 1,000 residents. In 2011, opioid overdoses killed more than 2,000 New Yorkers, more than double the death toll 7 years earlier. So we have a problem of a growing heroin epidemic in this state. It has been growing steadily for years. We are dealing with it with an all-levers approach, what in criminal justice we call an all-levers approach, attacking every aspect of the problem. Naloxone is an important part of that effort because it counteracts overdoses of heroin and prescription opioids by getting victims breathing again. The way you die in an overdose is that you stop breathing. And this gets people breathing again, gets time to get them to the hospital, and then we're able to get people into treatment. Each of the kits, and we'll have a demonstration in a moment, contains 2 pre-filled syringes of naloxone, 2 atomizers for nasal administration, sterile gloves, and an instruction booklet. The kits cost around $60 each and have a shelf life of about 2 years. It used to be that naloxone was only available for intravenous injection. You can only administer it that way. And that was difficult. You couldn't give officers in the field the challenge of doing that. The technology has been developed so that it can now be given as a nasal spray, and the only thing standing in between our police officers around the state and this life-saving tool has been money, and we've solved that problem with the drug forfeiture funds. In Suffolk County on Long Island, we had a pilot program since 2012 that put naloxone in many squad cars. More than 170 lives were saved by officers in Suffolk County. We know this works. We know there is no contraindication. There is no problem if you think someone had a drug overdose and it turns out they have some other problem. Naloxone doesn't harm anyone. It's been proven to be safe. We've been using it in the pilot program. And as I say, It is part of our all levers approach. We've been reformed our laws in New York State to make treatment more available. We have set up the iStop program to track prescription drugs. Just last week, I announced the results of an investigation conducted with the state police that shut down 2 massive intertwined narcotics rings in western New York that resulted in 32 arrests and the seizure of $1 million worth of heroin and several $100,000 worth of cocaine. We are doing everything we can to deal with this epidemic, and we'll continue to work with our colleagues in government and law enforcement. It is a pleasure to be here with you today, and I look forward to being in many other police departments around the state that follow Gilderton's lead, and I'd now like to turn it over to Chief Carol Lawler.
Good morning. I'd like to thank Attorney General Schneiderman for the generous funding he's providing to the Gilderton Police Department Opiate Overdose Prevention Program. This program purchased Narcan kits for every Gilderton police officer to carry. We are trained and ready to go. Heroin knows no boundaries. It's in our cities, the countryside, and in the suburbs. It is most definitely here in Gilderton. And it's not just heroin, as the Attorney General said. It's OxyContin, Vicodin, codeine, amongst others. All opiates respond to Narcan. Narcan saves lives. Our paramedics have carried it for years, so why not our police officers? The quicker the response, the better outcome. I recently read a quote from a mother whose child died of a heroin overdose. She said, "I lost my 22-year-old son to a heroin overdose. Every day my world seems to get worse. There are no words left in me to describe how it hurts. That rotten killer drug." As a mother, these words break my heart. As a police chief, I know that having our officers carry these kits every day might very well prevent loved ones from having to experience this type of tragedy. I would like to thank our EMS department, specifically Dr. Doynow, for spearheading this program in Gilderton. And again, our many thanks to Attorney General Schneiderman for providing the funding to make this happen. Thank you.
Thank you. Thank you. And as the chief mentioned, this is a very important point. Heroin is in every community. Years ago, there was a stigma, if you were a middle-class kid, about heroin that seems to not exist today. It is in poor communities, it is in wealthy communities, it is in the suburbs, it is in rural areas, it is in the inner cities. This is a different kind of epidemic than we've ever seen with this particular drug. And the prescription opioids, while we've cut down on the flow of them in New York State, continue to be a problem because we're the only state in the country so far that has an iStop program. And now I'm proud to introduce the chief executive, whose county is first in the COP program, Dan McCoy.
You know, where do you start? Attorney General Schneiderman, I want to thank you for your leadership, just not here in Albany County, but across the state of New York, because it has to start at the top. And statistics don't lie. If you look at the last 16 months here in Gilderton alone, 26 heroin overdoses, 7 people died. This program can make a difference. It needs 35 officers with these type of kits to go out into the community. If this happens, it's not a question when it's going to happen again. Is what we can do to prevent someone from dying. And the chief reading that letter from that mother, that's heartbreaking. You talk about a 21-year-old son that overdosed, and that's what they think about every day. I want to compliment the Attorney General for his leadership, just not in this program, but in the iStop, because we do need to make a difference. You know, sit here with to stand here, I should say, with my colleagues, and to go to the community we represent. It's, you know, we don't like to sit there and say, hey, we have this epidemic, we have this problem in our community, but we need to make a difference, and we need to work together in a partnership to make a difference in the community to stop this heroin, to not be number 6, which I did not realize in the state of New York of 62 counties. It breaks my heart to think about that. And it's even harder when you deal with parents and you sit there and you say, look, you know, let's not, you know, it's hard to arrest them. They have a drug problem. Let's help them get them cured. And Attorney General Schneiderman, I thank you for your leadership, and everyone here from the town of Gilderton, especially Ken Runyon for, where are you, Ken? There you are. Ken Runyon for his leadership here, and the chief for allowing your police officers to be trained to carry these kits to make a difference in the lives of the residents of Gilderton. So thank you.
All right, thanks. Pleasure. And now it's a great pleasure to introduce Senator C.C. Kachik, who was, among her many great accomplishments, worked in a volunteer ambulance corps and has seen up close what life-saving tools can do and has seen these emergencies firsthand. Senator? Thank you.
Thank you, Attorney General Schneiderman. These naloxone kits save lives. And Senator Breslin and I did a public forum in the Capitol in December at the urging of a mother who said, my 19-year-old daughter tried heroin one time, and was hooked. She was dead within 4 months. And when we had the forum and learned about the naloxone kits, it was clear they need to be out in our communities. They need to be in the hands of first responders and police, people who arrive on the scene first. We're saving lives by making sure this is out in the community, but we need to do more. We need to make sure our kids stay away from this drug and all opiates. We need to make sure we have treatment programs for people who are addicted to this drug so that they have the opportunity to get off of it. We don't have enough treatment programs. We need stricter penalties to make sure people who bring this into our communities are going to jail. The Senate Democrats unveiled a comprehensive package of bills last week that I think addresses all of those issues. My bill in particular would take savings from closing of correctional facilities and put that money into treatment programs for addictions. We need to make sure we have the resources in place to help people get off the drug. But this is an amazing first start, and I want to echo, this is happening everywhere. And what the forum showed me, this could be my family. This could be any of us dealing with this crisis, and we need to put in place resources to help our families recover from this and stop it from happening in our community. So I want to thank the Attorney General for bringing this resource here and all the local elected officials for bringing it to our community. Thank you.
Thank you, Senator. And now another great partner in public service, Assemblymember Patricia Fahey.
Thank you. I'm very proud to represent the 109th District, which includes Guilderland, and really want to commend the AG, and really proud to think that Guilderland is the first to jump on this. I commend the chief, I commend the town supervisor, and all the board members. This is important, and this is when I wear my mom's hat as much as I wear an assembly member's hat. It's not just launching this program and making sure these kits are available. What you're doing to bring attention to this issue is just as important, because the statistics are nothing short of alarming. I have to say, this has impacted, I have a son, I have 2 teenagers, so I'm really paying attention to this as a mom, but it even impacted my college search, and I found myself subtly encouraging my son one way as opposed to other ways, and I remember seeing, while visiting some colleges, reading the college newspapers and seeing the articles about untimely deaths, and knowing exactly what it was, because I asked, that it was drug-related. Incredibly accomplished student at incredibly accomplished universities. So it is alarming. I couldn't agree more. There is a need for all levers, and just in talking to our county sheriff, Sheriff Apple, the stats alone in Albany, I didn't know we were number 6, but that does mean we need all fronts on top of this issue. I can't commend you enough, because we need every tool at our hand, and really appreciate the efforts here. It's a great start. Thank you.
Thank you. And now our town supervisor, Ken Runyon.
I want to echo what many have said before me, but I want to commend and thank the Attorney General Schneiderman for providing Guilderland with the funding and this very important tool that our police officers will be using. This is a tool which will save lives. Guilderland is not immune from the problems that many other communities face in the drug overdoses. I want to also commend our Chief of Police, who has been in the forefront in public safety for our residents and for our community. And again, I want to thank the Attorney General, and I'd like to thank all my colleagues for being here today to commend you for the important work that you've done.
Thank you very much. Thank you. And now we're going to hear from Dr. Donald Doynow, who is the medical director and who will actually provide us with a demonstration of how naloxone works. Doctor?
The kits are put together for the officers to carry. They have 2 doses of Narcan. It's very easy to administer. There's an atomizer. There are no needles involved. So the safety issue is not a problem that we would have with IV or IM administration. The onset of action actually is 3 to 5 minutes. The data looking at IV naloxone is actually about 3 minutes for onset of action. But then you also have the time to place an IV, which can be up to 10 minutes. So it may actually be faster onset than someone attempting to start an IV. Why don't I show you folks how it works? It's very simple. Come on over this way.
So these are the kits. See how simple they are, how small they are. And they contain the gloves and everything else you need to administer on site.
So what they will have is a kit, as the Attorney General mentioned, 2 doses of Narcan, an atomizer, which fits on the end of the syringe, which basically takes the medication and sprays it into the nose so it's absorbed by the mucosa, and just a sharps kit that they can put the breakables in afterwards so they're protected. They also have gloves. So let's just show you guys how it works. Essentially, the 2 pieces screw together. The atomizer fits on the end. The police officer would end up doing half in one nostril, half in the other nostril, and that's it. They're done. Okay, we can do it again. So we're assuming they're...
It really is.
So it's really simple. One nostril, half of it, the other nostril, the other half. And within 3 minutes, we should be seeing a significant change in the patient's status. They should start to awake. They should start breathing again on their own. As the police officers often arrive quicker than the medics because they're out in the street and doing their patrols, we're going to be shaving minutes off from the time that this drug is administered.
Thank you, Doctor.
You're welcome.
And thanks to you all. It begins here. The only way we deal with an epidemic like this is by all working together, and every part of the law enforcement community is involved, and it's great to have the leadership we're seeing here in Guilderland and in Albany County.